Hi, I'm David Rapaport, board-certified plastic surgeon in New York with over 30 years of experience. Right now, let's just talk briefly about incisions for liposuction of the hip and waist area. You're seeing some examples of markings for those incisions, as well as some examples of the scars in the long run. On many people, I look at the hip and waist even as one area when we price. Not always, but more often than not. And that's partly because I can do both through the same incision. So you're seeing a photo, I'm having a theoretical waist in front of me, with this part being the waist, this part being the hip. And now this person's facing you. So I'm gonna usually I can get away with one incision alone. And this is an exceptional area because it's bulging out. You don't generally need those two angles. So I'm gonna go up a little bit into the waist. Why I call them two areas is because they are. The waist is an area that you can't make too small if you do a good job, on a woman at least. I've never had a woman say my waist is too small, never ever. But you can't make it look like someone tied a rope around her. So in general, the hip waist can do very well with just one little scar. The waist, I go aggressive. The hip, I'm just, your butt is a round thing. The hip is just a little bulge on the ball. So you want to make sure to keep the ball as a nice full ball. We like butts that are perky and have fullness. We just don't want them to have that added little, thing on them. So hip liposuction is a matter of delicacy in many women. Obviously, some women do have big hips and you have to be more aggressive, but you have to keep the goal in mind, which is still to have a round butt. And again, many times these lipos might be combined with fat grafting or aggressive equalization, which means moving the fat around inside your body without ever taking it out. These are all good things that can help us get better results. So hopefully this video was useful. Thank you.